Don't skip this video. I receive a lot of comments about shedding, where people ask questions about whether and when their shedding will end while using Dutasteride, Finasteride, and/or minoxidil. If you want to hear my thoughts, please make an effort to pay attention to this video. Now, before we start this video, please consider sharing this with a friend, liking the video, and of course, subscribing to the channel. And for additional channel support, become a member for as little as $2 a month. But seriously, try not to skip around too much in this video, because you'll need the full context to understand everything. As always, check out the links in the description below. First, let's start off by examining the hair growth cycle in people who don't have any hair loss disorders like chronic telogen effluvium, or alopecias like alopecia areata or androgenetic alopecia, also known as male or female pattern hair loss. So the typical human hair growth cycle consists of 4 main phases. The first phase, anagen, is the growth phase where the hair follicle actively produces hair. This phase can last from 3 to 7 years, depending on genetics and other factors. About 85 to 90% of the hair on a person's scalp is in the anagen phase at any given time. The second phase, catagen, is a transitional period lasting about 2 to 3 weeks, during which the hair follicle shrinks and detaches from the dermal papilla, effectively halting hair growth. The third phase, telogen, is a resting period that lasts for about 3 months, during which the hair follicle remains dormant, and eventually the old hair falls out to make way for a new one to grow. Finally, the exogen phase is a significant yet often overlooked part of the human hair growth cycle. While some consider it an extension of the telogen phase, it represents a distinct phase where the shedding of old hair occurs. During exogen, the hair that has been in a resting state detaches from the scalp, falling out naturally or being aided by daily activities like brushing or washing. The exogen phase is a normal part of the hair cycle where shedding is important. This shedding is essential for maintaining a healthy balance of hair, making room for new growth to emerge from the follicles that have been dormant. The exogen phase can vary in duration and intensity, influenced by factors such as genetics, health, hormonal changes, and stress levels. Within the exogen phase, there is a period of dormancy where the hair follicle remains inactive for some time. So we can see that shedding is normal. Let's revisit the exogen phase to understand what happens between hair shedding and the dormancy period. Our main focus will be on individuals who don't have any hair loss disorders. According to the American Academy of Dermatology, people lose 50 to 100 hairs daily, and this number may increase naturally with age. And according to the article Telogen Effluvium by Elizabeth C. Hughes and Dahlia Saleh in Stat Pearls, in a healthy person's scalp, about 15% of hair is in the telogen phase, while 85% is in the anagen phase. So in people without hair loss disorders, you will observe shedding at all times as well as growth. Some hairs will grow continuously for years on end and eventually fall out after 3 to 7 years of this continuous growth. And after this period, a dormancy of anywhere from 3 to 6 months. So what happens when you have androgenetic alopecia? What happens to the anagen phase and the telogen phase? Well, according to Layla Asfour, William Cranwell, and Rodney Sinclair in their article, Male Androgenetic Alopecia, its impact on hair growth phases, androgenetic alopecia notably alters the hair growth cycle, particularly affecting the anagen growth and telogen resting phases. The authors explain that the anagen phase is significantly shortened, inhibiting hair from reaching its full length and thickness, which decreases hair density. Simultaneously, there is an increase in the number of hairs entering the telogen phase prematurely, leading to a shift in the anagen to telogen ratio from approximately 12 to 1 to 5 to 1. This imbalance favors the telogen resting phase over the anagen growth and worsens the appearance of thinning hair. Additionally, the condition causes a stepwise miniaturization of the hair follicles, driven by dihydrotestosterone, also known as DHT. This process results in the follicles producing progressively finer and shorter hairs with each growth cycle. Over time, these hairs may fail to penetrate the skin's surface, leading to visible thinning and balding areas on the scalp. The authors emphasize that while treatments like minoxidil and finasteride can manage these symptoms, they require continuous use. So, now that we have the description of what happens to the hair of people who have androgenetic alopecia, we need to understand what is going on in the anagen to telogen ratio. I'll need you to pay very close attention. If you have androgenetic alopecia, instead of your hair follicles on your scalp spending 3 to 7 years in continuous growth, it may shorten this growth phase from years and eventually to months. The resting phase will then go from, say, 3 months to possibly to half of a year, or maybe even a year plus. And this phenomenon will happen progressively depending on how sensitive any hair follicle on the scalp is to DHT. If you have a severe form of androgenetic alopecia, in just 1 to 2 hair cycles, you could see extreme amounts of thinning across the scalp, with long phases of telogen and short phases of anagen growth. As the hair follicle becomes suppressed by DHT, it grows and sheds at a progressive rate. The only way to slow down, stop, and if the damage to the hair follicle isn't too extreme, potentially reverse this miniaturization process in androgenetic alopecia would be to use a 5-alpha reductase inhibitor like Dutasteride and Finasteride. So how would Dutasteride or Finasteride help? Well, we need to look at a very special study conducted on Finasteride and the benefits it and potentially other 5-alpha reductase inhibitors have on androgenetic alopecia. Please pay attention because in this section we are going to talk about some key concepts that involve the hair cycle and a phenomenon known as synchronized shedding. In the study titled, quote, "Long-term 5-year multinational experience with finasteride 1 milligram in the treatment of men with androgenetic alopecia," unquote, published in the European Journal of Dermatology, Kaufman and colleagues looked into the long-term efficacy and safety of finasteride at 1 milligram a day in treating men with androgenetic alopecia over 5 years. The study combined data from 2 phase 3 trials involving more than 1,500 men with male pattern hair loss. Over 5 years, men who consistently took finasteride experienced a significant increase in hair count compared to baseline, reaching a peak at 12 months. Although the improvement slightly decreased afterward, it remained consistently higher than the starting level, resulting in an average increase of 38 hairs in the designated target area by the end of the study. Men on finasteride also demonstrated noticeable improvements in patient self-assessment scores, investigator ratings, and global photographic assessments. In contrast, men who received a placebo experienced a steady decline in hair count, culminating in an average loss of 239 hairs in the same area over 5 years. Finasteride's effectiveness appeared to peak after 1 to 2 years of treatment within the confines of the 5-year study. In other words, research shows that finasteride increases the number of hairs in the growth phase, in anagen, and normalizes the balance between growth and resting phases. This effect is similar to releasing a brake, letting hair follicles grow freely without the inhibitory influence of DHT. The authors make a statement, though, in the discussion section of the paper. They say,
quote, "Based on the predefined endpoints utilizing photographic methods, hair counts, and global photographic assessment, peak efficacy was observed at 1 to 2 years of treatment with finasteride. This observation of an apparent peaking effect is likely due, in part, to the previously reported beneficial effects of finasteride on the hair growth cycle, based on a phototrichogram study. In that study, initiation of finasteride treatment was shown to increase the number of anagen phase hairs and to increase the anagen to telogen ratio, consistent with normalization of the growth cycles of previously miniaturized hairs due to the release of hair follicles from the inhibitory effects of DHT. Consistent with these results, finasteride treatment was also shown to increase the growth rate and/or thickness of hairs, based on analysis of serial hair weight measurement, because these beneficial changes in the hair growth cycle are dependent on when therapy with finasteride is initiated and occur rapidly. The affected hairs are driven to cycle in a synchronous manner. If these hairs have somewhat similar anagen phase durations, they would enter telogen phase as the anagen and catagen phase ended, followed by subsequent shedding in a partially synchronized fashion. This would be expected to produce a gradual decline from peak hair count after a period of time equal to the average anagen phase duration. Eventually, as subsequent growth cycles recurred, these hairs would be expected to become increasingly independent, thereby losing their synchronous character as their growth cycles further normalize over time, leading to a sustained increase in hair count at a plateau above baseline, as suggested by the 5-year data presented here." Unquote.
Initially, the treated hairs grow and shed in sync due to this sudden release by 5-alpha reductase inhibition and thus from DHT suppression. As their growth cycles normalize over time, hair from hair follicles desynchronize and shedding decreases, leading to a stable hair count above baseline. However, there will be periods of growth and shedding where the count fluctuates above and below baseline. It's like all the hairs initially marching in sync but eventually finding their individual rhythms as they adapt to the new growth pattern. It's likely that a higher percentage reduction in DHT causes greater synchronization as the overall interaction between DHT and hair follicles diminishes. For example, the 2006 Olson and colleagues study on Dutasteride showed a decrease in scalp DHT of 50% to around 80% at doses of 0.5 mg up to 2.5 mg. A similar shedding pattern may occur with strong treatments. That being said, how the follicles synchronize also depend on which stage the hair follicles are currently in. Let's make some things clear here. Shedding can occur when you start treatment, and it can even delay for a whole year. The truth is, no one can tell you how long it will take for your shedding to subside. You even have your natural shedding that occurs on hairs that are more DHT resistant. Furthermore, other scalp conditions such as telogen effluvium and even different forms of alopecia may influence how you shed hairs. So, if you're asking for a time frame for when your shedding will stop, this is an impossible task due to the different genetics and environmental circumstances one may be going through. The best thing to do would be to stay on your hair loss treatment stack. Don't remove and add things too frequently. People typically do this when they want to see results as soon as possible. This is faulty thinking and could also cause increased shedding. People also need to temper their expectations and be realistic. If you started late on treatment and you're a Norwood 5, don't expect to get to a Norwood 3. Even if you see people on the internet making such improvements, they are outliers. Earlier, we talked about the process of stepwise miniaturization in the context of hair follicles affected by androgenetic alopecia. In the article, quote, "Male Androgenetic Alopecia," unquote, Layla Asfour, William Cranwell, and Rodney Sinclair describe stepwise miniaturization as the gradual shrinking of hair follicles over multiple growth cycles. This results in progressively finer, shorter, and less pigmented hairs due to the effects of dihydrotestosterone, DHT, ultimately leading to visible thinning or balding. However, I'm going to coin a new term, stepwise follicular augmentation. Stepwise follicular augmentation is the reverse of stepwise miniaturization. Essentially, if the environment around a DHT-sensitive hair follicle is sufficiently deprived of DHT and the follicle isn't too damaged from previous exposure, it may, given enough time and subsequent growth cycles, return to an anagen length similar to or the same as it was before the onset of androgenetic alopecia. So remember that the normal range of anagen hair growth is between 3 to 7 years, depending on factors like gender and race. Also remember that as DHT suppresses the hair follicles, this anagen is shortened. So in a way, the hair follicle has to revert by going in the opposite direction. It will spend each cycle in an anagen phase that may be slightly longer than the last, and a telogen resting phase that may be slightly shorter than the last. The long-term studies on Finasteride by Kaufman and colleagues, and Rossi and colleagues in their respective studies provide valuable insights into Finasteride, but in general, DHT suppression in the scalp and its effectiveness over time in treating androgenetic alopecia. Kaufman's 5-year study demonstrated synchronized growth, while Rossi's decade-long study further detailed how finasteride's benefits evolve. Initially, gains were evident at the 1-year mark, but the most significant improvements occurred after 5 years, with this period showing the highest increase in hair count. After 10 years, the treatment remained effective, though some participants experienced a slight decline from the 5-year peak, indicating a plateau or modest decrease. Nonetheless, finasteride sustained hair growth throughout the decade, reinforcing its long-term benefits. Rossi and colleagues describe this process that I'm terming stepwise follicular augmentation, stating,
Quote, presumably under the influence of finasteride, whose blood concentration is not going to be reduced over time, previously miniaturized scalp hairs continued to become longer, thicker, and more cosmetically significant during 10 years of treatment because it is still working as a selective type 2 5A reductase inhibitor. Since miniaturization of scalp hairs in androgenetic alopecia develops over a period of many years, it is not surprising that reversal of this process may also take a number of years. Unquote.
So how do you know if your hair follicles are too far gone? You'll never really know how your hair follicles will be on treatment. Only time will give you this necessary perspective. Listen to this part again. You'll never know how your hair follicles will truly end up on treatment. Keep this in mind. At the absolute least, we can expect to slow down androgenetic alopecia. However, many people obtain stability, and some get hair count gains as the years go by. I won't go into this too much because there are no real practical ways to know if your hair follicles have been damaged too much by DHT to properly recover. All I can say is you need to start your treatment as soon as you can. Those who start treatment as soon as possible have better outcomes with their hair. Also, it tends to be the case that the aggression of your intervention determines the likelihood of you keeping your hair. So say, for instance, a 19-year-old who has a Norwood 3 hair loss pattern, starting with Dutasteride, as it is shown to reduce scalp DHT more than Finasteride, is the most aggressive choice given the severity of hair loss at such a young age. This could also apply to someone who just wants a bit more assurance. So say a 32-year-old who is now a Norwood 2 deciding to use Dutasteride. This isn't to say that Finasteride isn't effective, but clearly Dutasteride is more effective and maintains a similar side effect profile with a side effect rate that is similar if not lower than Finasteride. You can see this in the paper titled, quote, Comparison of Clinical Trials with Finasteride and Dutasteride, unquote. Here we see that when it comes to sexual side effects like impotence, decreased libido, and ejaculatory disorder, the group treated with Dutasteride had a similar if not slightly lower prevalence of sexual side effects compared to the group treated with Finasteride. Now, this is a meta-analysis of sorts, and the data is retrospective. However, it does establish some sort of comparison between those treated with Dutasteride versus Finasteride. At the very least, it's enough to say that Dutasteride has the same rate of sexual side effects. However, I will say this. Due to Dutasteride having a half-life of 5 weeks, it could take a bit, but not forever, for side effects to subside after discontinuation as the levels of Dutasteride lowers in the bloodstream. In comparison, Finasteride has a half-life between 6 to 8 hours. The Olson and colleagues paper, titled, quote, The Importance of Dual 5A Reductase Inhibition in the Treatment of Male Pattern Hair Loss, results of a randomized placebo-controlled study of Dutasteride versus Finasteride, unquote, also shows this to be the case too in terms of side effect rate between Dutasteride and Finasteride. However, when going up to 2.5 milligram of Dutasteride, the rate of side effects becomes more prevalent. But the takeaway here is that these drugs are safe. Also, this video isn't about side effects. So if you have problems with that, then please go figure out your issue elsewhere. The side effects are so overblown at this point with Finasteride and Dutasteride. I only question if people care about treating their hair loss. If this is an issue for you, voice your concerns elsewhere. Compared to other alopecia drugs like JAK inhibitors for alopecia areata, and mind you, JAK inhibitors suppress the immune system because alopecia areata involves the body's immune system attacking hair follicles. Those that fear-monger and complain about finasteride and dutasteride should count themselves lucky that they have androgenetic alopecia and not alopecia areata, because the treatment for androgenetic alopecia is safer and straightforward. Anyway, I digress. It's very important that you start as early as possible when you have androgenetic alopecia. This means the moment you notice it. We have 2 10-year studies that show this to be true. These are, quote, long-term 10-year efficacy of finasteride in 523 Japanese men with androgenetic alopecia, unquote, by Masayuki Yanagasawa and colleagues. And the other paper is, quote, finasteride 1 milligram daily administration on male androgenetic alopecia in different age groups, 10-year follow-up, unquote, by Rossi and colleagues. Both papers display with empirical evidence that early intervention leads to better long-term results. And don't worry, we also have a study for dutasteride. The study titled Long-Term Efficacy and Safety of Dutasteride 0.5 milligram in Korean men with androgenetic alopecia, 5-year data demonstrating clinical improvement with sustained efficacy, authored by Sang-Min Choi, Soon-Hyo Kwon, Woo-Young Sim, and Bark-Lin Liu, investigated the long-term efficacy and safety of dutasteride 0.5 milligram in Korean men with androgenetic alopecia. In this retrospective analysis involving 99 male patients who used dutasteride 0.5 milligram over a period of at least 5 years, 89.9% showed improvement based on the investigator global assessment score, while 93.9% experienced a halt in androgenetic alopecia progression. Using the basic and specific, also known as the BASP classification, clinical improvements were observed in 52.5% of patients classified as the basic type, 75% of those in the specific F for frontal type, and 82.2% categorized under the specific V for vertex type. Essentially, not only is dutasteride shown to be effective, but in cases where the hair loss isn't too advanced, dutasteride works better. There are some studies that show that permanent changes occur to DHT-sensitive hair follicles after long-term exposure. In the study, quote, Androgenetic Alopecia, New Insights into the Pathogenesis and Mechanism of Hair Loss, unquote, Rodney Sinclair and colleagues consider the role of the erector pili muscle in androgenetic alopecia, providing important new insights into the pathogenesis of hair loss. This pattern of hair follicle miniaturization is unique to individuals with androgenetic alopecia and differs significantly from other hair loss conditions like alopecia areata. The erector pili muscle, a small band of smooth muscle attached to the hair follicle, has traditionally been considered to have a minimal role in hair growth. However, Sinclair and colleagues have demonstrated through 3-dimensional reconstruction of the erector pili muscle in scalp biopsies that in androgenetic alopecia, the muscle progressively becomes infiltrated with fat. This weakening or loss of attachment to the bulge, where the stem cells are located, correlates with irreversible hair loss, as the connection of the stem cell niche to the muscle is essential for maintaining the bulge's integrity and ensuring normal shedding and regrowth cycles. In conditions such as telogen effluvium and alopecia areata, where the erector pili muscle remains attached to the follicle, hair loss is generally reversible. The muscle remains attached, giving the hair follicle time to recover and return to normal hair production. These findings underline the intrinsic role of the erector pili muscle in hair follicle biology and suggest that therapeutic strategies targeting this muscle's function could halt or even reverse the miniaturization process characteristic of androgenetic alopecia, but you can never know this without a biopsy. And if you biopsy the scalp, the targeted area gets scar tissue, and hair might not grow back from the area. In some people, the hair follicle is too sensitive to DHT, and the genetic propensity for androgenetic alopecia is too strong for finasteride. My thinking on this is very simple. You'll never know if you're in this group of people. For this reason, dutasteride at 0.5 milligram a day would be appropriate. The Olson and colleagues study from 2006 shows us that between 0.5 milligram to 2.5 milligram of dutasteride suppresses scalp DHT by 50% to 80%. If the idea is to be aggressive to your treatment, but also reasonable, you need to look at the data and make the conclusions for yourself on how you want to approach the situation and how practical your approach is. That's not my job for you. Talk to your doctor and do your own research. Let's go through scenario examples to recap and help you better understand what hair follicles go through in androgenetic alopecia before onset, during onset, and during treatment. Before the onset of androgenetic alopecia, the hair growth cycle in a healthy individual generally follows a well-balanced pattern. In the anagen phase, the longest phase, hair grows continuously for 3 to 7 years at about half an inch per month. Hair follicles remain active, supported by essential nutrients and growth factors, resulting in full-length, thick hair. After this, the hair enters the telogen phase for around 3 months, during which it stops growing but remains attached to the dormant follicle. About 10 to 15% of all hairs are in this phase at any given time, and at the end of this resting period, the hair naturally falls out and is replaced by new hair entering the anagen phase. In a healthy scalp, the ratio of anagen to telogen hairs is around 85 to 15 or 90 to 10, ensuring a predominance of growing hair. This balance results in full, healthy hair with minimal shedding, as new hair constantly renews what is lost. During androgenetic alopecia, without any treatment, the hair growth cycle undergoes significant changes, particularly affecting the lengths of the anagen and telogen phases. In the anagen phase, growth phase, the cycle becomes markedly shorter. Instead of lasting 3 to 7 years as it would normally, this phase now only extends for several weeks to a few months. Such a reduction in growth time prevents hair from achieving its full length and thickness. The hair that does grow is often finer, weaker, and less pigmented, a phenomenon known as follicular miniaturization. Simultaneously, there is an increase in the number of hairs entering the telogen phase, resting phase, prematurely. While this phase generally remains around 3 months in duration, a greater proportion of hair follicles shift to this phase, disrupting the balance between anagen and telogen phases. In a healthy scalp, the anagen to telogen ratio is typically around 12 to 1 or 10 to 1. However, in cases of androgenetic alopecia, this ratio shifts dramatically to approximately 5 to 1 or even less favorable. In more severe instances, these changes lead to more shedding and visibly thinner hair on the scalp. The overall density of hair decreases because the growing hairs are fewer, finer, and more prone to shedding due to the increased proportion of follicles in the resting phase. This cycle of shortened anagen and increased telogen phases contributes to the appearance of baldness, particularly in areas commonly affected by androgenetic alopecia, such as the crown and hairline. When an individual with androgenetic alopecia begins treatment with a 5-alpha reductase inhibitor like Finasteride or Dutasteride, and if the hair follicle isn't too damaged by DHT, the hair growth cycle gradually recovers through a process known as Stepwise follicular augmentation. The reduction of DHT allows the hair follicles to grow for progressively longer periods in each cycle. Initially shortened to just a few months due to androgenetic alopecia, the anagen growth phase starts to extend, giving the hair more time to grow thicker, longer, and stronger with every new cycle. As a result, the hair shafts become more robust and pigmented, leading to a fuller appearance. Meanwhile, the telogen resting phase shortens as the anagen phase extends. Over time, fewer hairs remain in the resting phase, reducing excessive shedding. The balance between the two phases improves, shifting the anagen to telogen ratio in favor of more hair follicles actively growing rather than resting. This results in a healthier proportion of hair follicles in the anagen phase, effectively stabilizing hair density. During the initial stages of treatment, follicles synchronize in their cycles, leading to a period of heightened shedding as they adjust to the healthier growth pattern. This phenomenon is known as synchronized shedding. However, over time, the follicles desynchronize and each finds its unique rhythm, reducing shedding as their growth cycles normalize. With continuous treatment, hair growth can gradually stabilize above baseline levels as the follicles normalize. This improvement may continue over several cycles, eventually leading to a plateau in hair density that is higher than the pre-treatment levels. Stepwise follicular augmentation significantly improves the appearance of hair, though it may not fully reverse the miniaturization of severely damaged follicles. Nonetheless, those follicles that respond to treatment continue to improve gradually, creating a fuller and thicker head of hair. The natural hair growth process is quite sophisticated, and maintaining the balance between growth and shedding phases is crucial for healthy, voluminous hair. In healthy individuals, most follicles are typically in the anagen, actively growing phase, while a smaller number are in the telogen, resting phase. Androgenetic alopecia drastically shortens the anagen phase when it affects the scalp. As a result, new hair starts entering the telogen phase much earlier than expected, leading to follicular miniaturization and hair thinning, which eventually results in noticeable balding. Medications like Finasteride and Dutasteride can significantly reduce DHT, helping restore the hair cycle and gradually recover follicles. The hair remains in the anagen phase for longer, with thicker, more pigmented strands and reduced shedding. Treatment requires patience and consistency. Although synchronized shedding might initially occur, it will stabilize as follicles establish their growth patterns. The goal is to slow, stop, or even reverse miniaturization, though expectations should remain realistic. Stick to your treatment plan, avoid frequent changes, and manage expectations for the best results. Consistent use of 5-alpha reductase inhibitors will maintain improvements, leading to thicker and fuller hair over time. Okay, so that's it for this video. So if this was somewhat helpful, consider becoming a channel member today. It's only about $2 a month. That's way less than your cup of coffee and other vices and addictions you may have. And also, it would certainly help me out. And at the same time, please share this video with other people who may be confused when it comes to shedding, because I get this question a lot, and I'm hoping by just making this video, it can be clear to people that, hey, stop freaking out about shedding. And honestly, if you're so concerned about if Finasteride is going to work for you or won't work for you, you might as well just go for Dutasteride. Just my opinion, not a doctor, just a guy on YouTube, right? But you might as well just go to Dutasteride, ask your doctor about it. And please don't get too hung up over the side effects. It could be nocebo, right? When you prompt yourself with your psychology to think negatively about a particular treatment because you may have heard some stories online or some anecdotes in real life, this can prime you to think that the treatment will do that to you on a, subconscious kind of level. So I'm just rambling at this point, but if you got this far in the video, comment in the comment section below W. Yes, like the literal letter W. W? I don't know. Anyway, thanks for watching this video. I really appreciate you guys, and I hope to see you in the next one. Peace.